Good afternoon and welcome to the Massachusetts eHealth Institute Behavioral Health Equality Incentive Program, or eQIP, for grantees. This is the introductory orientation webinar. First of all, congratulations on being selected to participate in MIHI's eHealth Equality Program. In today's webinar, we will present an overview of eQIP components with a more detailed review of certain program requirements. This will include some changes that have been made to the program since the solicitation was posted. Representatives from HIMSS Analytics will also present an overview of the ambulatory EMR adoption model, or AMRAM. And finally, we will review the program's timeline, important dates, and give you some additional resources. My name is Judy Iwanski. I'm the manager of MIHI's eHealth Equality Program. Also with me today are Sean Kennedy, MIHI's Director of eHealth Programs, and Olivia Joplin, eHealth Programs Coordinator. From HIMSS Analytics, the Healthcare Information and Management Systems Society, we have Michelle Glenn, Senior Director, Engagement Management and Consultant, who will review the HIMSS Ambulatory EMR Adoption Model, or AMRAM. There will be time at the end to answer questions submitted during the presentation. If we run out of time, you may submit additional questions in writing. This presentation will also be sent to participating grantee organizations. The goal of the eQIP program is to help guide behavioral health organizations to increasingly sophisticated use of health IT. As you progress through the health IT maturity cycle, the program incentive funding will assist you with the adoption and implementation of certified EHR technology, or CERT, as listed in the ONC Certified Health IT Product List, CHAPL, and the interoperability through connection of these EHRs to the Massachusetts Health Information Exchange, or Mass Highway. This will help prepare the behavioral health sector for exchange of information to support larger community health statewide efforts. To participate in this program, grantees are required to first sign and return to MIHI the following items, which were emailed to you last week. First, a signed contract and task order. Second, a completed patient service revenue form, as illustrated in the slide. It is important that MIHI verify that each grantee meets the eligibility criteria to participate in the program. Because of some ambiguity in the solicitation regarding what documentation was required in order to attest that an organization meets program eligibility thresholds, all organizations are being required to complete and sign the PSR form that was emailed with your contract and to provide the required supporting documentation, a Uniform Financial Statement and Independent Auditor's Report, UFR, or similar audited report. We strongly suggest organizations include a spreadsheet, like the example that was provided in the email, that clearly supports the attestation by typing the information provided in the form, by tying the information provided in the form back to the UFR supporting documentation. The third piece required is a form that lists all of the organization's behavioral health facilities using the chart provided as a template. In order to prepare for submission of your health IT information for the AMRAM evaluation, we're requiring grantees to list specific information regarding each behavioral health facility that's part of their organization. Note, this should be limited to those facilities that provide primarily clinical behavioral health care. For example, not an FQHC or an educational facility that you may own. If your organization does not own any such facility, we ask that you detail in the form how and where your providers will use health IT to document patient care. For example, in an EHR that you own and manage, or in another organization's EHR. All of this information must be returned with your signed contract before you can participate in the program. In brief, the following are requirements of the eQIP grantees. Number one is to use certified EHR technology, or CERT. Note that while CERT is not required to meet the requirements of eQIP Stage 1, it is required to meet other milestones. Either the 2011 edition or the 2014 edition or voluntary certification editions are acceptable. Use of CERT does not guarantee interoperability, but certification does help ensure the EHR will provide standards-based functionality that will support interoperability. It's important to have discussions with your vendor about your EHR system capabilities. Second, you must submit a questionnaire to HIMSS, the Healthcare Information and Management Systems Society, to determine the EHR adoption baseline. Third, develop a transformation plan. Fourth, commit to achieving all 4 eQIP milestones. And 5, submit midterm and final reports and attend grantee in-person events. There have been a few changes made to the eQIP program since the original solicitation was issued. All of these changes are beneficial to grantees. The first change you'll note is in Milestone 1. It originally required that grantees achieve MRAM Stage 3 as well as complete an acceptable transformation plan and highway use case. MIHI has moved achievement of MRAM Stage 3 to Milestone 2. Therefore, you may now receive the first milestone payment upon submission of a MIHI-approved transformation plan and highway use case. Second, notice in Milestone 4, the highway milestone, previously required connection to the Massachusetts highway. We will now accept transacting on another health information exchange so long as that HIE is connected to the Mass highway. Third, payments were originally tiered at 15% for Milestone 1, 25% for Milestone 2, 35% for Milestone 3, and 25% for Milestone 4. This has been adjusted to pay 25% of the total payment for each milestone. This gives a larger amount for Milestone 1 upfront. And the fourth change is the program duration. The end date has changed from December 31st, 2016 to June 30th, 2017. This gives grantees an additional 6 months to meet the program milestones. This slide illustrates the updated milestone requirements. Although we will not be reviewing these in depth in today's webinar, we do intend to schedule subsequent sessions to review each of the milestone requirements in depth. As I said earlier, you will be receiving this PowerPoint presentation by email. Once again, this slide illustrates the updated payment structure with grantees receiving 25% of the total for each milestone. For eQIP, MIHI has aligned Milestone 2 and Milestone 3 to the HIMSS Ambulatory EMR Adoption Model, AMRAM. This EMR adoption evaluation model focuses on key IT systems that need to be implemented for achieving higher levels of access, quality, efficiency, and safety. Before turning this over to HIMSS Analytics to walk you through the AMRAM model, I'd like to emphasize 2 points. First, the deadline for grantees to complete the HIMSS online questionnaire is April 3rd, 2015. Second, it's important that organizations make every effort to answer the questionnaire completely and accurately. Your MRAM score will determine your organization's baseline for milestone payments. In addition, grantees are required to incorporate the score and gap assessment findings into the transformation plan that is required for Milestone 1. I will now turn it over to HIMSS Analytics for a discussion of the AMRAM adoption model and review of the types of questions and information needed to generate scores and gap assessments. Michelle?
Thank you, Judy. Before we get started, I'd just like to do a sound check. Are you able to hear me?
Yes.
Yeah. Great, perfect. Thank you. Before we jump into the slide deck, I'd like to introduce some of my colleagues. Patty Harris is our Senior Director of Data Collection and Quality, and she will be really the primary contact that will be working with MIHI during this period of data collection. I'd also like to introduce Lauren Pettit. He is our Vice President of Research, and he will be very involved in putting together the EMR adoption model gap assessment that we will be delivering back to all of you following the assessment to allow you to create your transformation plans. My name is Michelle Glenn. I'm the Senior Director of Engagement Management for HIMSS Analytics, and I've been working very closely with MIHI on their Certified Educator program and putting this program together for all of you. Judy, you can move to the next slide. The first thing I'd like to do is talk a little bit about the ambulatory MRAM, and I don't want to spend too much time on this, probably 5 minutes, just to keep us within our time frame, but I do want to highlight some of the key elements of the AMRAM. The first thing to keep in mind is that we've identified some core foundational technologies that need to be in place, that we feel, that HIMSS feels needs to be in place in order to develop a fully evolved and highly sophisticated EMR environment. And so what we look for is organizations that have put these technologies in place and have enabled a patient-centered and seamless patient view of data. So all relevant data, all clinically relevant data is within the patient record. So a stage 0 organization is basically a paper-based organization. They really don't have a patient record at this point that is electronic. A stage 1 organization has started using computers, but again, it's primarily they're logging into the computer and capturing information from other websites. Again, not a patient record that is electronic. A stage 2 organization is really the beginning of that seamless view of the patient. They've implemented a system, a core system. It could be Cerner, it could be Epic, any one of those. But the key is that it allows for the integration of data from different areas throughout the organization. So the integration of orders, the integration of results, the ability to start documenting clinical documentation and start creating clinical decision support. So stage 2 is really that foundational EMR system. When we get into stage 3, what we're looking for here is now clinicians starting to use the system to do documentation, and specifically the nurses. There's some level of clinical decision support, but it's still very early. They may be using computers when they're visiting with the patient, but the computers could also be at desktops outside of the room. So it's the beginning of clinical documentation. When we get into stage 3, the core thing that we look for here is the use of the computerized practitioner order entry. So orders are starting to get generated in the system, and clinical decision support associated with orders is also important here. So, any alerts associated with medications, so drug-drug interactions, anything like that would be critical here. The other thing related to stage 4 is at this point we're starting to create structured data. And so the structured data then allows for the development of more sophisticated clinical decision support. When we get into stage 5, we expect to see a patient portal in use. We are not specific about exactly how the patient portal is being used, but we do expect patients to be logging into a portal and communicating in some way with the clinic or the behavioral health organization. So they might be scheduling an appointment, they might be getting results back, they might be able to pull up their most recent visit summary, but there's some level of patient portal usage. At stage 6, we start to expect to see some pretty advanced clinical decision support in place and some proactive care management. And I use that term, and really what we're talking about here is the system automatically generates reports and alerts that indicate the clinician needs to follow up with patients, and may also be automatically doing that follow-up, whether it's scheduling phone calls so that patients remember to come in for their visits. But there's some pretty proactive outreach going on here. We also expect to see some clinical decision support triggering while the physician and while the clinician is interacting with the patient, either triggering protocols, care plans, workflows, etc. At stage 7, and the stage 7 organization is really a paperless environment. So no paper is getting generated during that patient visit, and that's very important. So as the patient moves through their experience, all clinically relevant information captured during that visit is captured electronically. We expect to see very advanced clinical decision support, and we expect the organization to be able to demonstrate improved outcomes as a result of the use of their technology. Specifically in the area of population health. Those are really the key elements of the ambulatory MRAM, and I'm happy to take questions when we get to the end of this presentation. Let's go ahead and move on to the next slide. Okay, so what we're doing here is we're going to be capturing information from all of you. It's a survey. It's not a super long survey, and you will be receiving, as soon as MIHI finalizes their grants with all of you and the grant contracts, you will receive login details from MIHI with a link and login credentials. And you will need to log into that survey, and I'm going to walk you through some of the screens that you'll see. Once you complete the survey, we will then generate the AMRAM gap assessment. Between the time you complete the survey and the time we generate that gap assessment, your survey will go through a quality review process. And so what we're going to do, and we recognize that everybody will complete their surveys at different times, is every Tuesday, any completed surveys we receive from you, we will put through the quality review process, and then we will generate those gap assessments by the end of that week. So it's really important that you let us know as soon as you're finished with your survey so that we can, in fact, move forward with the rest of the process. If you complete your survey, say on a Wednesday, it will get processed the following week. So I want to really highlight this sort of Tuesday deadline, because if you complete your survey prior to Tuesday, you will be able to get your gap assessment that week. Now, part of this project was that we educated Mihai in the AMRAM and in all the requirements associated with achieving the different levels of the AMRAM. And so they're fully capable of answering all of your questions and associated with the survey and with the model itself. And we are, of course, here to support them in that effort. And so please feel free to reach out to us as a team whenever you've got questions as you go about completing the survey. Judy, go ahead and move on to the next slide. This is just a picture view of what's going on. And so what will happen, and I want to highlight that box in the middle that's in red. If, for example, you complete the survey and it goes through our quality review process on Tuesday and it's not accurate, or there are some illogical responses or something like that, we will have to reach out to you through Mihai and get some clarity on the responses, which could potentially delay the creation of the gap assessment that week. So it's very important that as we work together, we're communicating very closely. And if at any point while you're doing the survey you've got questions, just reach out to us so that we can answer those questions, so that hopefully when the survey does come through, we can quickly review it and validate it. Let's go ahead and move on to the next slide. So you'll get a link and you'll get login details, and this will come from Mihai. The key individuals who will really have the knowledge associated with being able to complete the survey are individuals familiar with the systems installed, so that core EMR product that is installed. Because there is an element, and this is a clinical model, it's about data associated with improved outcomes and clinical care of the patient. It is important that clinicians who are engaging with the environment and doing their clinical documentation in the environment and are working with any clinical decision support that has been created, their knowledge will be important to completing the survey as well. There are questions around information that is being exchanged with organizations outside of your group. And so it's important that the individuals familiar with that continuity of care document and how it's getting exchanged with others are also consulted during the completion of the survey. Let's go ahead and move on to the next slide. So when you log in, this is really the main dashboard that you will use to get through the survey and get to the questions. You will come to a screen prior to this, and there's a big button in the middle of it that says click here to start your survey. And then you'll come to this, and we call this the dashboard. And I've circled two main areas in the dashboard that you really need to worry about. The area on the left is what we call the tree. And so you can quickly get to different places in the survey through the tree. But the area that's called software in the tree underneath the specific facility is, you can click on that, or you can click on the area to the right that I've circled where you see facility name, and then there's last update, and then there's a little sort of book looking thing. You click on the book and it'll take you to the next slide. And this is where we start actually capturing data. So let's go ahead and click to the next slide. Okay, so this is the main screen that you'll come to, and there are really 3 pages. You can see at the top there's software installations, EMR functions, and software plans. The 2 key pages that are very critical to being able to accurately score your organization are software installations and EMR function. And when you come to this page, any data that we may have on an organization will be pre-populated, but in your case we won't have any data. So what you're going to want to do is click the Edit button to the right of the page, next to, to the right of each application name. And so ambulatory EMR is really the most critical thing that we need on this page. And if you click the Edit button, it opens up the questions on the bottom of the page. And in this view, I have those questions open. And this is where we capture information on the actual vendor you have installed for your ambulatory EMR function. And again, to go back to the model, that's stage 2 of the model, that core clinical data repository, allowing for one seamless view of the patient as you build out your environment further. Okay, let's go, and they're drop-down screens, so you can click in the drop-down, select the vendor. If the vendor isn't there, there's an other field as well. This next page that Judy's clicked to is the EMR function page, and this is really the screen that allows us to create that gap assessment for you and provides us with all the detail associated with the different stages of the model so that we can accurately score you. And I didn't have enough space to include all the questions, but this is a sampling of how the screen works. So you would click on that sort of high-level box first, clinical data repository, and then any elements associated with that apply to your environment. So if you are in fact doing nursing documentation, you click that. If you are doing physician documentation, you click that. If you haven't started doing that, don't click it. You can click all and then unclick things that don't apply, so there's a clear, and then there's also a clear all button. So there's some tools in here to help you kind of complete this page very quickly. The important thing to keep in mind is that you want to save each page as you go. The other important thing to keep in mind is that you do not need to finish it all in one go. Judy mentioned the deadline for this project, so you do need to make sure you complete it so that you have enough time to create your transformation plans. But you might have to pop in and then pop in the next day again in order to finish it up. But please remember to click the Save button before you leave each screen. Okay, let's go ahead and move on to the next page. This is a sample of the gap assessment that you'll get, and what we're going to be doing, and you can see that the very first column, it'll come to you in an Excel spreadsheet, and the very first column will have the stage and the elements of the survey that apply to that specific stage. And there's a brief description in the blue of the components in that stage that are part of the model. And if for some reason you did not achieve a certain element of the stage, that element will be highlighted in red, and it'll say, and it'll be blank in the column that is D, where you see yes, so that you will know, very quickly what your score is and why it is, and what we call this the gap assessment, what the gap is in the higher level stage that is preventing you from moving up the stages of the model. And from this, you will be able to create your transformation plan. And I believe that this was my very last slide. We can move on to the next just to make sure that I covered everything. Yes, okay. So thank you very much. We're very excited about working with all of you on this project.
Great. Thank you, Michelle, for participating in the webinar. Just very briefly, we mentioned in the solicitation that MIHI is collaborating with the Executive Office of Health and Human Services to provide optional additional funding for eQIP grantees to maximize EHR interoperability capabilities. The State Innovation Model, or SIM, Mass Highway Grant is a companion grant to the eQIP. Additional funding to optimize grantee highway use cases and maximize EHR interoperability, excuse me, to achieve interoperability across the continuum of care. This companion grant is closely aligned to eQIP, but is a separate funding program and will require a second, although very light, application through the Executive Office of Health and Human Services. The amount of funding is forthcoming pending federal approval. This timeline slide repeats the important dates. Remember, the completed contract, patient service revenue form, and behavioral health organizational facilities form that were emailed to you last week should be returned as soon as possible. No organization is officially accepted into the eQIP program until its eligibility has been verified and a contract with MassTech has been signed. Additional webinars will be scheduled to review program requirements, including the transformation plan design and highway use case development. The deadline for grantees to complete the HIMSS online questionnaire is April 3rd, 2015. As Michelle said, when all the contracts are returned, we will be emailing you the log-on information. The deadline for grantees to submit a transformation plan to MIHI for approval is July 1st, 2015. And the period of performance is now running through June 30th of 2017. We encourage you to let us know if you have questions, and we have set up an email specifically for eQIP providers. That's eheq@masstech.org. And please make sure that we have the correct contact information from your organization's project manager. The MIHI website, mihi.masstech.org, is also a good resource. You may visit the education page for upcoming events, presentations, toolkits, and other resources. One resource that may be of interest is on March 25th. It's an overview of the MIHI EHR Planning and Procurement Toolkit, newly developed for organizations looking for guidance on procuring EHRs. We ask one, if you plan to send an announcement about this eQIP program and your eligibility, we ask that you please coordinate with MIHI. All right, we'll now take those questions submitted during the webinar. Questions may also be submitted by email. And we have a couple of questions here. Great. Okay. One question. Do we need to register with HIMSS and complete the AMRAM questionnaire? I think we covered that earlier. When all the contracts are finalized, MIHI will send each grantee a link, their credentials, and login information. Will we get a copy of the presentation? Yes, we will email a copy of the presentation to each grantee and also have it available on our website with a recording of this question and answer and presentation. Are the questions on the AMRAM survey available in advance of completing the survey so we could speak to our EHR about particular components? Perhaps Michelle would answer that. I think my understanding is that once you go on the HIMSS questionnaire, you don't have to complete it all at once, so you may talk to other people. Michelle, do you want to add anything to that?
Sure, absolutely, and that's absolutely right. You can log in and fill it out, at your convenience. So you don't have to complete it all at once. But if you do need a hard copy of the questions, I think Patty's team can certainly create something, and we can send it out to you. That's not a problem at all.
Great, thank you, Michelle. The next question. Who do we contact if we have a question while completing the survey? Most of it should be available, again, because it's specific to your organization. But if you have questions, happy to contact MIHI, myself, Judy Gajwanski, or Olivia. Next question. Is there a template for the midterm reports? We haven't gotten that far. Not at this moment. There will be additional webinars, especially designing the transformation plan and what's required, because NEHI needs to approve that before you're qualified to receive the payment for Milestone 1. And we will send out guidance about what information we do expect during the midterm and annual reports far in advance. Is March 12th the deadline submission of the terms and conditions and supporting documents, hard copy or by email? Well, we would prefer you get them to us as soon as possible. That's tomorrow, especially the contract and the facilities information. Email is fine if it's easier for you to mail a hard copy, but the email is quicker and easier for us to look at. But as I said before, you're not technically a grantee until the contract has been accepted and we verify your eligibility, which we can't do without those supporting documentation. My question is, what if a client refuses to participate in the Mass Highway information sharing? How is this handled?
So this is Sean Kennedy. I can reply to that. So part of this grant is a requirement that you agree to the set of milestones that we're proposing here. So the expectation, if you're accepting this contract or the grant, is that you will be working toward connecting and transacting over the highway. We're happy to work with you. I think there's a range of use cases that you could consider. If one particular use case isn't particularly favorable, maybe there's another use case we can come up with. But the intent of these grants is that you will be transacting over the Mass Highway, and we know that there may be some challenges that are going to come with that, but that's also going to prompt us to work with you and the other grantees and frankly the whole sector to overcome some of those challenges.
Great, thank you, Sean. Another question asks, when are the grantee in-person events scheduled? Again, we'll let you know far in advance. We haven't scheduled them at this point. As most of you know, the contracting took a little longer than we had originally anticipated in the solicitation. So the schedule has moved out, but we will certainly give plenty of opportunity to make sure people are available. When do you anticipate that the SIM funding RFR will be issued? Two points to that. The one I'll answer is that once you reach stage 4, milestone 4, which you know you can take anytime after milestone 1, then you will be eligible for the SIM program. Sean, do you have an insight into when the RFR will be issued?
I do not. We just recently chatted with the SIM team. They're actively working with CMS, who's the funder behind that, to get the final approvals. Everything's complete on their end and our end. It's the matter of getting the final approvals. There's huge interest at the federal level, so we don't anticipate any concerns about approval. It's just a matter of when it's going to get approved. But I will also say that the application for that RFR, we work with them to make it very light, meaning I believe, if I recall, it's a one-page, just kind of tells who you are. And the application that you went through for us really is the body of the big body of work you had to complete to get eligible for SIM.
Great, thank you, Sean. Next question. The questionnaire does not appear to be behavioral health focused. The workflow and issues may be different. How will this be addressed? As we said in the solicitation, we expect that you'll be able to meet the stages of a MRAM. If there are particular items that are not applicable to your practice to behavioral health, you may apply to NEHI for a waiver from those particular requirements.
And just to clarify on that, so we're working with HIMSS, and the goal really is to get each of your organizations up to stage 5 of MRAM. So, but we recognize that there may be a criteria as part of AAMRAM that isn't going to apply to your organization. So if you do have something to that effect, you let us know. What that will do, however, is that will you will not technically be able to reach whatever that stage is for MRAM. You will be able to move through our milestones because we're granting the waiver, but if you do not meet a criteria for a stage of MRAM, then you will not actually be able to hit that stage for MRAM. But it doesn't prevent you moving through our milestones, getting those payments, and so forth. So it's just something to consider upon those waiver requests and if we grant a waiver.
Great, thank you. The question was not if we participate, but if a patient refuses, since they would have the right to decline participation in sharing information with other providers.
So on that one, so you are correct that the highway has an opt-in requirement, so the patient is going to have to choose to opt in. The intent is not to control what the patient does. They have the choice to participate or not participate in the highway, but you as an organization, we would expect to participate. So we need you to participate, build the information pathway, basically make it work, and then if you choose to pursue with the SIM funding to grow transaction volume, we'll work with you on some approaches and strategies on how to get that patient consent or opt-in, but I guess the worst case scenario would be if every patient chooses not to opt in, then you can't send transactions. So we have not yet seen that scenario, but if it's something that you're concerned about, we can certainly work with you early to get the messaging prepared for your patients so that they do in fact opt in. So yes, so the big thing is that you need to get connected and have the pathway available, and we'll work with the patients to get them to opt in.
Great, thank you. The next question is, what email address should be used to send the contract and materials? We would prefer that you return it to our legal department, which is where who you receive the contract and materials from, Ross Venables. That would be the best way to go. And again, another question, will we get a copy of the presentation? Yes, you most certainly will. We have a couple more minutes. If that's the end of the questions that were written in, please, as Sean said and Michelle reiterated, we're here to help you work through this process. We answer any questions. If you have anything further to do with this MRAM process, please let us know. If it's specific to your organization, we'd like to have all of our grantees be successful in making it through all 4 milestones. So we encourage you to ask questions. My email's on here, and the eheq@masstech.org is specifically for grantees. And if we receive a lot of questions that are similar or we think are applicable to many grantees, we'll create a FAQ, a frequently asked questions, and send them out to everybody so you can all benefit from questions that you may not have thought of yet. Oh, we did receive a question. Is documentation returned via email okay, or do you want hard signed copies returned via U.S. Post? Email is sufficient. You may send that. One more question. Can Patty send copy of the survey questions right away? Michelle, I think you had mentioned that Patty could provide copies.
This is Patty. I will send it to Olivia to share.
Terrific.
Thank you, Patty.
Okay. So if you heard that, we will get that out as soon as we receive it from him. We're really excited and thank all of you. We know this process took a little bit longer than we expected, but we're glad you're all on board. We're looking forward to working with you and helping you meet the milestones. Great. Thank you all very much.